Okay, Doc, we got a good one here.
Yeah, Dr. Rand, I'm 36 years old and had testicular cancer at age 33. I had my left testicle removed where the tumor formed. It was a seminoma. I've been clear since February 2014 and still have to have regular CAT scans and blood work for the next 2 years. I've always been in great shape at pre-cancer, 6'4", 215, and hanging between 10 to 12% body fat. Immediately upon recovering from surgery, I noticed huge losses in strength, stamina, and overall energy. Also, my body fat has slowly gone up to around 20%. I still train hard and eat fairly clean and yet struggle to stay in what would be considered good shape. No longer great. I've mentioned all these things to my urologist and he assures me that my testosterone level is still considered, quote, acceptable, end quote. I've tried a few of the all-natural, over-the-counter testosterone boosters over the last couple of years, which all help a fair amount, but I still do not feel like myself. What, if any, are the associated cancer recurrence risks if I were to aggressively pursue some sort of HRT with my doc? Also, what would be any known potential risk of cancer recurrence if I were to start an oxandrolone cycle in an attempt to get back to feeling like myself? Well, quite frankly, I have to be careful here because of two things. One, I'm not an oncologist, and two, I'm not your physician. You've got a guy who has trained in this area, certainly more so than I have, and has seen all your numbers and knows you and all that sort of thing. That said, in a general sense, whether it's prostate cancer or testicular cancer, it depends upon the doctor, but there's, I probably shouldn't give you the name. There are doctors I have dealt with who are oncologists and urologists or both, who have told me that it's fine to give my patients, whether they had prostate cancer or testicular cancer, testosterone, because either I had one patient that went off his testosterone prior to surgery, and the urologist out of DC was furious because the guy dropped like 20 pounds. He's worried about cancer, and he went off his testosterone. He said, "I need you healthy for the surgery, if nothing else."
Right.
Plus, he was aware of the latest research that testosterone is not the problem. It's dihydrotestosterone, something that can be converted from testosterone, yes, but it's not the testosterone per se. And we mentioned earlier, now they're cycling testosterone to treat prostate cancer.
Mm-hmm.
As far as testicular cancer, it usually occurs right about this age. 32, I think, is the mean. Might be 33, right where he is. We, interestingly, just a fun fact, we see an elevated HCG level typically when someone has testicular cancer. But once it's removed, I don't know. I'm not aware of any reason to restrict HRT.
How could you treat those people? Let's say they do have prostate cancer or testicular cancer. After that, how do you help them if you can't help them?
Well, you'd want to monitor. The common sense approach would be to continue to monitor, as he is doing,
right,
for cancer anywhere.
Right.
Not just in the other testicle, for example, but anywhere in the body.
Right.
And there's plenty of ways to do that now, some of which are recognized and approved by the FDA, and some of which are pending approval. I like to bring up the Oncoblot test, which looks for a protein called ENOX2, which is found either in fetal tissue or in cancer cells. And obviously he's not a fetus anymore, so if it were I would look for ENOX2 proteins. You can also look at something called nagalase, which can be elevated if you have a virus. So you can't depend upon it 100%, meaning if you have elevated nagalase, doesn't mean you have cancer. But the presumption is it's fairly accurate, at least in the 80% sensitive and what's the word? And specific. For viruses in cancer. But if it were negative, if you have a negative nagalase test, then the presumption would be, hey, I'm cancer free. And you do those. Again, I'm not an oncologist, I'm not his doctor, but you would do those at a regular interval to make sure you stay that way.
Right.
again, I'm not sure why this particular doctor would be hesitant to give testosterone, because that's not the reason why people get testicular cancer, as far as we know. And of course, the easy presumption is, hey, you're missing 50% of the producer of testosterone.
Right.
You're probably going to have some drop off. I don't know what acceptable is, but I do know this. Again, I'm not trying to pick a fight with this doctor, please.
Yeah.
But you got to do a little research and find out, okay, what does acceptable mean? Because we see acceptable levels all the time, meaning within normal range, where for someone's age, it's 269 to it all depends on the laboratory, to 836, and this varies. This is what I've seen from country to country. I mentioned a guy from Denmark recently.
Yeah.
The top of the range for a male in Denmark is like 636.
Wow.
Yeah. Does the whole country suffer from low testosterone?
Wow.
And ours, for that same age group, I should give a reference. It goes up to, I think LabCorp goes up to 1197 for that age group. So,
yeah. Wow.
well, they've adjusted now. LabCorp's gotten, I don't want to say better, but they have started to age adjust it now so that it goes to 9 something. Once you reach a certain age. But the whatever the level of acceptable is just a number too. And Dr. Morgenthaler has headed an international consensus which essentially states, there's about 8 points, great points he makes, that, hey guys, you don't treat numbers, you treat people. So, always use the numbers to help you come up with a diagnosis, but first and foremost, you treat symptoms. So, again, I don't know enough about the case and I don't want to cause a stink, but I would respectfully look into, what are the risks with someone who is an oncologist, and if this particular doctor you've seen doesn't give you the right answers, always. I mean, we're consultants. We're not know-it-alls. Find a few more opinions, just like you would if you went to a lawyer and he didn't tell you what you wanted to hear. Right. Make sure that there's a consensus. Still doesn't mean that the 3 out of 4 are right. The 4th one might be the right one, but the odds are with you clearly. 3 out of 4, but find out what the risks are, if there are any risks. Maybe another doctor would say, no, there's absolutely no risk to replacing testosterone. I don't want to mention any famous people, but there are people out there who we know have had testicular cancer, and surely, and it wasn't just limited to testicular cancer. There was some lung and brain involvement, and this particular person was using testosterone replacement therapy, and as far as we know to date, is many years later is very healthy.
Wow.
And
nice.
And so anyway,
good to know.
That's the first, and then. Definitely the over-the-counter testosterone boosters I would scrap, because we don't want them to convert to something we don't want, estrogen, for example, or dihydrotestosterone necessarily. Oxandrolone, the benefit of oxandrolone would be its anabolic effect, and it doesn't convert to estrogen. I don't think there's any increased risk with estrogen in testicular cancer. There is, obviously, we talked about with prostate cancer. So that just depends upon his physician and deciding whether or not he's got some wasting that needs to be treated or whatever. But it sounds like I'm doing too much hemming and hawing here. But cancer. Look, we're not talking about something that is a small thing. So I don't want to to overstep my bounds at all. But I hopefully I've given you some considerations here. Ways to pursue this and to get whatever the best answer is, an option for you, but I can't really go much beyond that.
I'm sure you understand. Thanks, Dr. Ryan.